Hi, so this is for discussion number 4. In the story about Calvin, I noticed that I thought Marie did a good job at trying to engage Calvin when she was talking with him and trying to get him engaged in their conversation and with his treatment plan. I thought she did a good job of listening to what his goals were and trying to establish goals with him and what he thinks would help him feel better, which he mentioned massage. I thought Marie did a good job at getting involved with the chaplain, and this demonstrated that she was trying to have good communication with other departments that were involved in Calvin's care. And the chaplain also wanted to continue that and involve the other people that were involved in his care, such as the nurses, doctors, and PAs that were working with him, and try to figure out a plan to best meet his physical and spiritual goals. A way of being that I would want to adapt if I was involved in his care team, but I would want to be a source of a caring presence for Calvin when I was talking to him or interacting with him, especially since his parents are estranged, and having a diagnosis with a brain tumor, probably a terminal diagnosis. He really needs people, especially the people that are taking care of him in his last days, need to be a caring presence for him. I would also want to be open-minded when working with him, especially since he has estranged parents, probably because they mentioned because he's gay and not religious. So open-minded, especially when discussing his spiritual needs, and thinking that, or remembering that his spirituality could be in a form that's different from others, especially since he's not particularly religious. Documentation that might facilitate effective interpersonal collaboration, I think. If I was involved in his care team, I would try to write very thorough notes encompassing everything that's under my responsibility, as well as including anything that he mentioned that was important enough for him to mention in our interactions. And then I think another way of documentation that would help facilitate interdepartmental communication is through consults during his stay. So those consults could be put in, I think, as far as I know, for the chaplain, if he feels like he needs to talk to the chaplain or have, a spiritual assessment done. Especially, another important one I think that would be important is psychiatry or mental health. And I probably noticed that because I'm on my psychiatry rotation now, but I know Marie, or maybe the chaplain, mentioned that he had tried to commit suicide or was endorsing suicidal ideations. And so that was a department that would definitely need to be involved, and so they could provide counseling, personal therapy, or even medication that would help him feel better in his last days, especially with his mood. And then spiritual goals and interventions that could be discerned as potentially meaningful for Calvin or his family I think he would need to have the spiritual goal of trying to find peace in the face of this terminal illness. And so Marie mentioned that he seemed like he had some sort of spiritual issue that was causing him distress. So I think that should be one of his spiritual goals, is to talk with the chaplain or someone to resolve that issue so he could have peace going into his final days. And then another spiritual goal would be to involve his family or reach out to his family. So because they mentioned that his parents are estranged, then I'm sure, resolving some things with them, or, knowing that they still care about him, would be something that would provide tremendous comfort spiritually to him in face of his illness. Right, thanks.